Hi, I'm Doug Donnelly, and welcome to Cecil TV. The struggle against drug addiction is one of our culture's most intractable problems. It has always been a life-threatening disease, but with the arrival of new and more dangerous substances, the dangers have become even more imminent. The need to get help for those affected is as great as ever. Voices of Hope is an organization that's on the front lines of this struggle here in Cecil County, and we welcome Jennifer Tuerke, Executive Director, and Aaron Wright, Program Director of Voices of Hope. Welcome.
Hello.
How you doing, Doug? Thank you.
So, for our viewers, what is Voices of Hope?
So Voices of Hope is a nonprofit recovery community organization. So we are a grassroots effort made up of people in recovery from substance use, family members who have a loved one who struggled or struggles with substance use or passed away, and allies of the recovery movement. And together we try to fill the gaps that people sometimes fall through when they're struggling with addiction.
So, how do you do this? Like through counseling, or I know from seeing Aaron make a presentation at the Cecil County Council that involves quite a bit. You're really in the trenches.
Yeah, so we do several programs or strategies to engage with people who use drugs, to try to make relationships with them, to teach them how to stay alive, to teach them about the treatment options that are available. We make ourselves available 24/7, 365 days a year to help people get into treatment, even if they only have Medicaid or no insurance. We are someone to talk to. We have 2 recovery houses in Elkton to help people access long-term recovery. And we have a recovery community center that hosts a lot of recovery support meetings. We partner with the Cecil County Health Department to do a catch line is what we call it, where there is somebody to answer the phone 24/7 and help people get into treatment.
I know that going back a couple of years, I remember it was a Halloween. It was drug take back day, and the czar, the national drug czar, came, and they had like a round table, and everybody said their piece, but the people from the community said that it's all well and good, but there are not enough recovery programs, not enough beds or whatever. So has that improved, or?
There's more beds outside of the county. The Cecil County still does not have an inpatient treatment facility with a detox, which is a real shame, since we have one of the most numbers of people dying from overdoses per capita right behind Baltimore City. Mm-hmm. So we end up taking people to treatment all over Maryland and even in other states. So that has not improved. A lot of outpatient treatment is here. But not the higher level of care that we really need.
Right. A question I have is, could you explain the concept of harm reduction?
Yeah, so harm reduction, capital H, capital R, harm reduction services, programs, they're intended to help people stay alive, people who actively use drugs, to stay alive through tools and education like Narcan, how to use more safely so that you don't die or have an infection, teach people how to not suffer so much. If people are going to use drugs, we don't want people to use drugs, but if you're going to use drugs, use them safely and stay alive until you're ready for treatment, because people who are dead, they can't recover. But if they're still alive and we're able to build relationships, build on compassion and understanding and, the truth telling, then we believe and we've seen that people will come to treatment if they can stay alive. So harm reduction is about staying alive, not getting an infection, keeping other people alive, and just reducing the harm that can come from using drugs of all kinds. Harm reduction is like using a nicotine patch instead of smoking. It's using sunscreen in the sun, to protect yourself from those harmful rays. And in Voices of Hope, a lot of harm reduction is about safer use equipment and education and wound care. Yeah, I hope that makes sense.
And I think, Doug, the important takeaway, at least for us, with our harm reduction services is, when we notice that the majority of the individuals that are overdosing and having a fatality are in pre-contemplation stage, because we use the stages of change model, right? And that is active use. And despite all our efforts to engage with individuals who are actively using, we really have no platform for engagement, right? I can't go up to someone who I think might be actively using and say, hey, can I spend 5 minutes? Talk to you for a minute.
Right.
And we can talk about some things. So really utilizing the safer use equipment and the naloxone distribution, do you have any wounds? Really all that is a cup of coffee for us.
Right. An opportunity to have
an
some
opportunity
face time.
To sit down with an individual and just, hey, how are you doing? Because a lot of individuals that are active use, they don't feel seen. So just actually engaging with them and talking to them, we plant this little seed. And when we see them again the next day, the next week, the next month, we keep putting water on that seed. Finally waiting for those words, hey, I'm ready for help. And we take them to the next stage through our recovery center where we do treatment navigation.
Right. What does the public need to know about the current state of the addiction crisis in Cecil County?
Well, I think the biggest message that I would like to get out is that Narcan is not enough, not with today's drug supply with xylazine in it. It's really great to carry Narcan. Every first aid kit should include Narcan, but please be aware that rescue breathing must take place as well. Xylazine is mixed in with so much of our drug supply on the street, and that is a sedative. It's a small animal tranquilizer. So it doesn't respond to Narcan because it's not an opiate. So it's important for everyone to know that rescue breathing must be done with the Narcan until 911 arrives. And if there is a wound, if you know someone, your loved one who's using drugs, has a wound that doesn't heal, chances are it's a side effect of this drug called xylazine. And if they won't go to the hospital or primary care doctor, that they can call Voices of Hope. We have a community wound care nurse team that can come and visit them if they request it, and hopefully get them into the proper care that they need to avoid amputation or severe scarring.
Yeah, the pictures I've seen are very scary.
And that's the big takeaway, that I'd like to give to everyone right now. And there's hope. People do recover. The recovery community in Cecil County is strong and large, and we appreciate anybody who would come out and engage with other people who might be struggling and be one of those voices of hope with us.
Terrific. Well, I thank you for coming. This has been Jennifer Tuerke, Executive Director, and Aaron Wright, Program Director of Voices of Hope. And I thank you for being here.
Thank you. Appreciate the opportunity.
Thank you for having us, Doug.
You're very welcome.